Hello and welcome to Adventures in Neuropathology with your favorite neuropathologist, Andrea Gilbert. Today I wanted to talk to you about why there are so many different types of brain tumors. The central nervous system is a complicated organ and it can give rise to a huge variety of different types of tumors. And so that's going to be the focus of our discussion today. The simple answer to why there are so many different types of brain tumors is that the brain is a very complicated organ and it has a wide variety of different normal morphologic appearances, which I'll go into in just a moment. So to give you an idea of how many different types of brain tumors there are, this is a list of the tumors that are officially recognized by the World Health Organization. Now, this does not include all of the unofficial variants that are recognized by folks who are practicing in the field, but these are the official recognized tumors of the central nervous system, as noted by the WHO or the World Health Organization. This is not a list to memorize, it's just to say that there's a wide variety. And so why is that? Well, if we take a look at our brain, this is a sagittal section of the brain. Here we have the cerebrum, the brainstem, cerebellum, and then the outer connective tissues between the brain and the skull. And so if we take a look at the cerebrum here, we can see that the cerebrum is made up of several different parts, including neurons, astrocytes, and oligodendroglial cells. The neurons form a six-layered neocortex, and the astrocytes are intertwined in and around the neurons. In the subcortical regions, there are white matter tracts comprised of oligodendroglial cells, which can give rise to oligodendrogliomas. The astrocytes in between the neurons, they can give rise to astrocytomas. By far and away, the vast majority of the different tumors that arise within the cerebral cortices are going to be astrocytomas and less commonly oligodendrogliomas. If we look at our next section, here in the cerebellar hemisphere, we can see that the cerebellar hemisphere is actually quite different from the cerebral hemispheres. So here is an example of the normal cerebellum in the adult on the left and in the young baby or fetus on the right here. So the cerebellum is composed of several different layers, and it's cerebellar folia, or the cerebellar cortex, the internal granule cell layer, which is in the middle, or innermost aspect, the Purkinje cell layer, which is sandwiched between the internal granule cell layer here and the molecular layer on the outside. And then in addition, the fetus or baby less than 1 year will also have an external granule cell layer on the very external most aspect of the folia. It is believed that in certain cases, a tumor called medulloblastoma is recapitulating the small round blue cells of the external granule cell layer that is present in the fetus and young baby less than 1 year of age. So again, in the cerebral hemispheres, there are astrocytes, oligodendroglial cells, which can give rise to astrocytomas and oligodendrogliomas. Those can certainly happen in the cerebellum as well, but what is more common, typically in children, are the medulloblastomas, which is believed to arise from this external granule cell layer, or recapitulates the external granule cell layer. Okay, so we talked about our cerebral and cerebellar hemispheres. If we consider that all of these are bathed in fluid in CSF, and the CSF is contained within these spaces or holes in the brain called ventricles, and the ventricles form this kind of holes within the brain, which are filled with CSF. And so here we have the lateral ventricles, we have the third ventricle, and then the fourth ventricle here. So we're seeing the third ventricle right here, and then the fourth ventricle right here. The ventricles are lined by very specialized cells called ependymal cells. Ependymal cells are these epithelial-looking type cells that have this ciliated apical surface. The ependymal cells are specialized cells that can give rise to ependymomas. Also in the this region, you can also have subependymomas arising here as well. The ependymal cells in certain areas can differentiate into choroid plexus cells. Choroid plexus cells can be found choroid plexus can be found within the ventricles. Oftentimes it's within the lateral ventricles as well as the fourth ventricle and the third ventricle. The choroid plexus, these cells are, again, epithelioid-looking cells here that form these papillary-type structures. And these choroid plexus cells can give rise to choroid plexus papilloma, atypical choroid plexus papilloma, and as also choroid plexus carcinoma. Those are pretty rare, though. If we move on above the superior colliculus, we can see that the pineal gland is located above the superior colliculus. The histologic appearance of the pineal gland is very different from anything we've seen here before. The histologic appearance of the normal pineal gland can be easily confused for tumor to the untrained eye. It has somewhat of a nested appearance. It can also have these granule cells or these granules in them, which are the melatonin. Remember that the pineal gland produces melatonin. It's involved in circadian rhythms. It can have somewhat of a nested or monomorphic appearance that to the untrained eye can look very, very, very much like tumor. And so that's one of the considerations to consider in the differential diagnosis of a tumor located very close to the posterior aspect of the third ventricle, that it might be biopsy tissue might actually represent normal pineal gland that very much looks like tumor. Okay, if we continue on, our next focus is going to be the pituitary gland. The pituitary gland looks very different if you're thinking about the posterior versus the anterior pituitary gland. Remember, the embryologic origin of the pituitary is very different for the posterior and anterior portions. The posterior portion of the pituitary gland represents a projection off of the hypothalamus embryologically, whereas the anterior pituitary gland is actually a gland that arises from embryologically the hypophyseal pouch or Rathke's pouch. It is composed of 3 different cell types. There are the basophils, the acidophils, and also the chromophobes. These can give rise to a variety of different tumors, which are primarily differentiated depending on which hormone they produce. So the pituitary gland, in the anterior gland, these can give rise to pituitary adenomas, which by far and away are the most common. They can also give rise to pituitary carcinomas, which are significantly less common, very rare. And the posterior pituitary gland can give rise to very, very rare tumors called pituocytomas. Okay, if we continue on in our exploration of the normal histology of the brain. All of the brain tissues and spinal cord tissues are covered by these externally located protective coverings. And there's 3 layers to these coverings. Collectively, they're called the meninges, and they include the peel layer that is directly overlaying the brain tissue. In between the peel layer and the external dura layer is the arachnoid layer. And then the externally most located layer is the dura. And this is composed of dense, fibrous connective tissue that is very dense, it's very durable, it's very strong. And so dura mater literally means tough mother, and it really is very tough, and it's difficult to separate from the underlying bony tissue of the skull. Okay, so if we consider all of these different histologic appearances, we note that the normal histologic morphology of the brain is very varied depending on where the location is. So if you consider the pituitary gland versus the pineal gland, the choroid plexus cells, which are specialized ependymal cells. If you consider the external coverings surrounding the entire brain, and then the different hemispheres, the cerebral hemispheres, which are composed of these nice pyramidal neurons, as well as a whole lot of oligodendroglial cells and astrocytes, which can give rise to oligodendrogliomas and astrocytomas. And then the cerebral hemispheres compared to the cerebellar hemispheres, which can give rise to medulloblastomas. So the wide variety of normal morphologic histology that can be seen in the normal brain gives us an idea of the complexity of the different parts of the brain working together. And tumor progression in any one of these areas can give rise to very different looking tumors that are very different from each other. So this is our whirlwind tour of the different histologic appearances of the different parts of the brain and how they can give rise to very different appearing and different acting tumors of the central nervous system. Okay, join us next time on Adventures in Neuropathology. Be sure to check us out on Twitter, Facebook, Instagram, and also our website, all entitled Adventures in Neuropathology. Okay, thank you.